Hi everyone, welcome back to Dr. Carri's Clinical Corner. Today we're going to be talking about the connection between the voice and the pelvic floor. And these might seem like two separate things, but there is very much a connection. So first of all, as long as I've been a pelvic floor therapist, we've talked about the voice and pelvic floor connection when it comes to childbirth. So kind of the things I teach my pregnant clients is and the goal is for them to have minimal or no tearing with the vaginal birth. So kind of some of the concepts we think about is whatever our mouth is doing, our pelvic floor is doing. And you probably, if you follow pelvic floor therapists, you've probably seen unclench your jaw, right? Because if your jaw is tight, your pelvic floor is probably tight. So kind of same thing in childbirth is what we talk about, open your mouth and that will hopefully open your pelvic floor. And I tell my patients who are pregnant, use your voice to help you. So I want you to try this. Think about this. So sort of lower tone sounds like la la la, go go go, fight fight. I'm trying to think of what you would say at a sporting event, like boo. That presses down on the pelvic floor. If you really pay attention, boo. And if you're connected to your pelvic floor, I can feel it because I do this every day, but I feel my pelvic floor kind of drop when I do that. But high pitch sounds like la la la, everything pulls up, including our pelvic floor. So we can use that to our advantage, right? And so in childbirth, it's we want those lower tone sounds, boo. But I really tell my patients, probably use just kind of those guttural noises, sort of those noises we would normally do when something hurts, right? Or it's hard, we groan. But we don't want to do that if we have a pelvic floor issue. So that's sort of a really way to think about the pelvic floor and the voice connection. So I'm gonna try to show you some anatomy pictures. So basically the diaphragm and the pelvic floor are parallel. I can't really find, this is my trusty Netter's anatomy handbook. I've had this since physical therapy school. So if you look at the chest cavity, this is where the diaphragm is. And then if you can imagine, the pelvic floor is below that. And they kind of work in parallel. So what happens when we take a breath in, the diaphragm expands down, and not just down, but we're going to talk in 2D at the moment. It goes down, so the pelvic floor goes down. And when we exhale, it goes up and the pelvic floor goes up. So they should work in parallel. But if we're holding our breath, then it's just gonna go down to the pelvic floor, right? So I kind of tell my patients, use your voice or at least your breath with exercise too. If you have pelvic floor issues, if you have prolapse, if you have pain, if you have bladder leakage, exhale when you exert yourself with exercise, when you're lifting up something heavy. Use your voice to sort of send some pressure this way. But the other thing, a lot of singers, I've worked with a lot of singers. So I live in Long Beach, California. I feel like I'm kind of far from Hollywood, but really it's an hour and a half, depending on traffic. That's everything in LA is depending on traffic. So there are a lot of singers that I've worked with. And what I notice for them, if they have pelvic floor issues, which is usually bladder leakage, they're not using their diaphragm properly. They're not breathing properly. And so we really want to work on the breath so that they can expand their lungs without the pressure down on the pelvic floor. So for some reason, most of the people I've worked with, they have some faulty breathing pattern. Either it's learned or it's because of an injury, and they're not breathing efficiently, and so their pelvic floor is maybe trying to engage to help them, but that's either just creating pain and tension or it's creating leakage. So this is one of those times that bladder leakage is probably not due to weakness. Everyone thinks I gotta do more Kegels, but even in these people, working directly on their pelvic floor helps temporarily, but once we fix their breathing and they have more lung expansion and diaphragm expansion, then their pelvic floor issues get better. I also see a lot of singers with neck pain and tightness because, again, if they're not using their diaphragm optimally, then they're getting air up here. So normally when we breathe, some should be in our chest, but a lot should be in our abdomen. So it's like when I take a deep breath, my abdomen should really expand and a little bit up here, but it shouldn't be, right? Which is what I see. That's not too exaggerated for some of the singers I've worked with. But if you're breathing like this every day, of course, this is gonna get tight, right? And if you're using your whole body to breathe, right? Like, instead of just like, I'm not a singer, but instead of just using your diaphragm and expanding here, filling up those lungs into the abdomen and using that air, then sometimes, like, I think of it as sort of like the really breathy sounding singers, like they're taking lots of breaths. That's like an inefficiency in the system and the pelvic floor. So sometimes treating the pelvic floor is not treating the pelvic floor. So it's really fascinating. It's really interesting to me. I took a course on this a couple years ago, and if you look at the anatomy, which I didn't look this up for you in this book, but sort of the vocal cords, they look a lot, the muscle layout pattern looks a lot like the vaginal muscles, and pelvic floor muscles on men and women have the same pattern, just you have a vagina or a penis based on what gender you are. But the muscles otherwise are the same. And then that muscle pattern looks like the muscle pattern in your throat around your vocal cords. So to me, it's very fascinating. And I've actually really like enjoyed working with singers, and you know, everyone who comes to pelvic floor therapy like thinks they need to do Kegels, thinks they need direct pelvic floor work, and most of them get better by doing some pelvic floor work and a lot of other things. So if you're having bladder leakage, maybe think about how your breathing strategy is, right? And so also, let me say this, your breathing strategy is going to be different depending on your activity. So when I talk about these deep breaths, right, that's like a relaxed breathing strategy. If you're running or playing a sport, you're not going to use that deep breath strategy. You got to like exchange air more often. If you're singing, depending on what kind of singing you're doing or playing an instrument, you need probably a different pattern. You really need to like use your breath and let it out slowly and controlled, right? So it's really fascinating if you're about to give birth to a baby, you know, and you want to not tear, you might think about your mouth being opened and exhaling and using those deep voice sounds to help you. So it's really cool and fascinating, I think, and hopefully that helped you think about some things in some new ways.